So we are here at the Deep Plane Brazil 2026, and this is a truly international meeting of plastic surgeons dedicated to facial aesthetics, facial rejuvenation surgery, the deep plane techniques, both open and endoscopic. And I'm here with a wonderful colleague from Morocco, and we're going to just talk a little bit to get to know Dr. Kouhen. And he is a renowned surgeon, specializes in the deep plane with the endoscopic approach as well. And I would like to know, he has been to so many international conferences, and it's really nice to have you here in Brazil. And we would like to know, how is your first impression of the meeting? And is this your first time in Brazil?
Yeah, this is my first time in Brazil. And my first impression when I came this morning is wow. It's like the Congress is fantastic. It's big. The main room conference is huge with multiple screens. It's beautiful. The whole organization is very professional because 2-3 months before, 5 or 6 staff contacted me for each part of the organization of the Congress, and I've never seen this in any Congress.
Right.
So the level of the professionalism in the organization is just incredible, and the hotel is fantastic. And people from all around the world, it seems to be maybe one of the best congress of the world.
Right. I am so excited to hear about your work later. And can you tell us a little bit more about what is your approach? What do you see in the endoscopic deep plane that attracts you to it?
Sure.
And what else you're going to be teaching today?
Sure. So I started my journey in endoscopic surgery about 5 years ago. And I start with simple things like endoscopic brow lift. That was my first endoscopic surgery, and in my nature is to always go further and improve myself. So I dive more in the face, and I start to do endoscopic brow with mid-face, and slowly
progressing.
I progress to do endoscopic full deep plane facelift with release of the whole ligament, dissecting the zygomatic branch, frontal nerve that is very problematic in the deep plane surgery.
Right.
And I will talk at 2 p.m. about this topic.
No, that'll be fantastic.
And tomorrow I have a live surgery where I hope everything, we will see everything.
Do you see what type of patient you see that really benefits from this approach?
Honestly, for me, it's people with slight sagging face. A lot of people, young, starting from their 30s.
Right.
Sometimes more young, 25 years old, they present low brows, low canthus, low mid-face, and they go to surgeons, plastic surgeons, and they do injection, threads, and nobody changed, nothing changed. So this surgery is able to change the position of deep structures, brows, canthus, mid-face, and also small jaws. So for me, it's the perfect surgery to put this surgery,
like instead of all the non-surgical things.
This surgery reveals the beauty for young people, and for more older, around 40s, it gives a fresh look without any scar.
Right.
And the best indication is people with slight saggy face, not with heavy jaw, small sagging neck. We can fix it in the same time with the deep neck lift.
Right.
But we fix the face with endoscopic deep plane, and we release the whole ligaments, lift the face vertically. The vertical lift The vertical vector is the most beautiful, and this is very powerful surgery.
Wonderful. Yeah. I think instead of, patients are also looking for solutions that are more permanent and don't like make the face look weird over time, like all the non-surgicals piling up, instead of go to the endoscopic surgery, which is like basically no visible scars.
Absolutely.
And really long-term results.
Absolutely.
So outside the OR, what are your main interests? What do you like to do? What are your hobbies?
So I like to go to the gym. This is my favorite moment in my life.
Weightlifting?
Yeah.
Yeah.
Yeah, I do weightlifting, functional training.
Right.
And recently I started again to play tennis because I played tennis when I was young. And and I started to play tennis again like 1 year ago.
How important do you think is physical activity for us surgeons?
Super important.
It's critical, isn't it?
Because we all have a lot of pressure when you have a lot of responsibility inside the OR, and we have to deliver beautiful work.
Right.
Now with the social media, the patients are more picky. They're aware of facial aesthetics.
Right.
They analyze everything.
The expectations
brows,
are very
dentist,
high.
mid-face, jaw. They want everything sharp. Good forehead height. So tomorrow we'll talk about forehead reduction. A very nice operation.
Right.
So
do you think it makes you perform also better physically?
Yeah.
And feel like you're at your peak,
because
right?
we spent many hours. Personally, I go to the operating room every day.
Like an athlete.
Absolutely.
Right? We are. This is many hours.
Absolutely. And by doing the functional training, we stay strong.
I do that too. I totally agree.
Yeah.
Yeah, because we need to have that, take care of our own bodies, and we don't talk much about that.
The back.
As surgeons, the
strong
neck,
back. Yeah,
the
strong
neck
back,
and the back,
neck.
and even like
Absolutely.
the hands, because it's all connected. So that is such an important part of it.
Absolutely.
Yes, and you have an office in Morocco, but you also operate in Dubai. How often do you travel?
So I travel every 6 weeks. I'm visiting doctor. I have my main clinic. I have 2 clinics in Casablanca, Morocco. I have my surgical clinic and a beautiful med spa for all the non-surgical treatment with doctors working with me. And in Dubai, it's very nice because we can see an international patients coming from all around the world. And I like to go every 6 weeks.
That's wonderful.
To perform only endoscopic surgery.
Right.
Yeah.
So welcome to Brazil. It's a pleasure to have you. I'm looking forward to learning from you, as we all are. And it's a pleasure talking to you and getting to know you.
Thank you very much. I appreciate it.
Thank you. That's it.
Flawless.
Wonderful. Thank you.